As we gain wisdom and experience with age, it's also true that some habits or behaviors that seemed harmless before might now carry risks we didn't face when we were younger. Doctors often see patterns among their senior patients, common practices that can unfortunately lead to health problems, injuries, or a decline in overall well-being. Have you ever wondered if there are things you're doing that your doctor secretly wishes you would stop immediately for your own good? Today, we're pulling back the curtain on exactly that. We'll explore 8 specific things that healthcare professionals frequently advise their older patients to avoid or cease doing right away. These aren't meant to restrict your freedom, but rather to protect your health and safety based on common medical knowledge and experience. Understanding these potential pitfalls can help you make informed choices to safeguard your health, prevent unnecessary complications, and continue living a vibrant, independent life for as long as possible. So let's dive into these 8 crucial stops that could make a real difference in your health journey. Stick around. This is advice straight from the professionals, designed to help you thrive. Let's start with 2 related points concerning medications. The first thing doctors warn against is self-medicating or altering your medication dosages without their guidance. This includes taking leftover prescriptions, borrowing medication from others, or deciding on your own to increase, decrease, or stop taking a prescribed drug. As we age, our bodies process medications differently, and interactions between drugs, including over-the-counter ones and supplements, become more complex and potentially dangerous. Only your doctor understands your full health picture and can safely manage your prescriptions. Closely related to this, and the 6th point doctors often raise, is the overuse of over-the-counter OTC pain relievers, especially nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen. While helpful for occasional aches, frequent or high-dose use of these common painkillers can lead to serious problems, particularly in older adults. These risks include stomach ulcers or bleeding, kidney damage, and potential cardiovascular issues. It's easy to think OTC drugs are completely safe, but overuse can be harmful. Always follow the dosage instructions, use them for the shortest time necessary, and importantly, discuss chronic pain management with your doctor. They can recommend safer alternatives or investigate the underlying cause of the pain rather than just masking it with potentially harmful medications. Always consult your doctor before starting, stopping, or changing any medication routine. The second crucial behavior doctors wish seniors would stop is ignoring new or worsening health symptoms, often dismissing them as simply a normal part of getting old. It's easy to fall into this trap. A new ache, persistent fatigue, shortness of breath, changes in bowel habits, dizziness, or even subtle memory changes might seem like minor annoyances or just inevitable consequences of aging. However, these symptoms can often be early warning signs of treatable or even serious underlying medical conditions. Attributing everything to age without getting it checked out can lead to significant delays in diagnosis and treatment. Early detection is often key to managing conditions like heart disease, diabetes, cancer, thyroid problems, infections, or cognitive decline more effectively. Your body sends signals when something isn't right. While not every symptom indicates a major problem, it's always best to err on the side of caution. Make it a habit to pay attention to changes in your body and report any new, persistent, or concerning symptoms to your doctor promptly. Don't assume it's just age. Let your doctor determine the cause. That's what they are there for. Being vigilant about your health is not complaining. It's being responsible. Number 3 on the list is something surprisingly common yet impactful: not drinking enough water and becoming dehydrated. As we age, our sense of thirst can diminish, meaning we might not feel thirsty even when our body needs fluids. Additionally, kidney function may change, affecting the body's ability to conserve water. Certain medications like diuretics can also increase fluid loss. Even mild dehydration can cause problems for seniors, including fatigue, dizziness, confusion, constipation, urinary tract infections, kidney stones, and electrolyte imbalances. Severe dehydration is a serious medical condition. Staying adequately hydrated is essential for nearly every bodily function, from regulating temperature and lubricating joints to transporting nutrients and flushing out waste products. How much water is enough? General guidelines often suggest around 6-8 glasses of fluid per day, but individual needs can vary based on health conditions, activity level, and climate. Water is the best choice, but other fluids like milk, herbal teas, and even water-rich foods like fruits and vegetables contribute to hydration. Don't wait until you feel thirsty to drink. Sip water throughout the day, keep a water bottle handy, and be mindful of your fluid intake, especially in hot weather or when exercising. Staying hydrated is a simple but vital habit for maintaining health. Now let's combine 2 points related to mobility and fall prevention. The fourth thing doctors advise against is making sudden jerky movements or rushing around. As we age, our reflexes might slow down, our balance might be less steady, and conditions like osteoporosis can make bones more fragile. Abrupt movements like jumping out of bed quickly, twisting suddenly, or hurrying on uneven surfaces significantly increase the risk of losing balance, falling, and sustaining injuries like fractures. Taking your time, moving deliberately, and being aware of your surroundings is crucial. This ties directly into the eighth point: wearing improper or unsupportive footwear. Shoes like backless slippers, high heels, flip-flops, or shoes with slick, worn-out soles offer poor support and traction, dramatically increasing the risk of slips, trips, and falls. Doctors strongly recommend wearing well-fitting, supportive shoes with low, wide heels and non-skid soles both inside and outside the home. Proper footwear provides stability, cushions joints, and helps maintain good balance. Investing in good shoes and moving mindfully are simple yet effective strategies to prevent falls, which are a leading cause of serious injury and loss of independence in older adults. Prioritize safety over speed and fashion when it comes to movement and footwear. The fifth habit doctors urge seniors to stop is going out in the sun without adequate protection. Many people enjoy sunshine, and it's important for vitamin D production. However, years of cumulative sun exposure take a toll on the skin. As we age, our skin becomes thinner and more susceptible to sun damage. Unprotected exposure to the sun's ultraviolet, UV rays, significantly increases the risk of developing skin cancer, including melanoma, basal cell carcinoma, and squamous cell carcinoma. It also accelerates skin aging, leading to wrinkles, age spots, liver spots, and leathery skin texture. Protecting your skin is essential regardless of your age. Doctors recommend applying a broad-spectrum sunscreen with an SPF of 30 or higher to all exposed skin every day, even on cloudy days, and reapplying it every 2 hours or after swimming or sweating. Wearing protective clothing, such as long-sleeve shirts, pants, and a wide-brimmed hat, provides an additional barrier. Seeking shade, especially during peak sun hours, typically 10 a.m. to 4 p.m., is also crucial. Don't assume that because you're older, sun damage doesn't matter anymore. Protecting your skin remains vital for preventing skin cancer and maintaining skin health throughout your life. Number 7 on the list of things to stop doing is neglecting recommended vaccinations. As we age, our immune systems naturally tends to weaken, making us more vulnerable to infections and potentially more likely to experience serious complications from illnesses that might be milder in younger individuals. Vaccinations are a safe and highly effective way to protect yourself against several serious and preventable diseases. Doctors strongly advise seniors to stay up to date on crucial vaccines like the annual flu shot. Influenza can be particularly dangerous for older adults, often leading to hospitalization or severe complications like pneumonia. The pneumococcal vaccine, which protects against pneumococcal pneumonia, meningitis, and bloodstream infections, is also highly recommended, often given in 1 or 2 doses depending on the type. Other important vaccines might include the shingles vaccine, zoster, and the Tdap booster, tetanus, diphtheria, pertussis. Vaccine recommendations can sometimes change, so it's essential to discuss your vaccination status with your doctor regularly to ensure you are adequately protected based on your age, health conditions, and lifestyle. Skipping vaccinations leaves you unnecessarily vulnerable to potentially life-threatening illnesses. Staying vaccinated is a key part of proactive healthcare in your senior years. So let's quickly review the 8 things doctors often warn seniors to stop doing immediately for their health and safety: self-medicating or altering prescriptions, overusing OTC pain relievers, ignoring new or worsening symptoms, not drinking enough water, making sudden movements, skipping sun protection, neglecting recommended vaccinations, and wearing improper footwear. These recommendations aren't meant to frighten you, but to highlight common practices that can inadvertently lead to problems. The good news is that awareness is the first step. By recognizing these potential risks, you can make conscious choices to modify these behaviors and adopt safer, healthier habits. Remember, taking care of yourself in your later years often involves being a bit more mindful and proactive than when you were younger. Always feel empowered to discuss any concerns, symptoms, or habits with your doctor. They are your best resource for personalized advice and guidance. We hope this video has provided some valuable insights based on common medical advice. If you found it helpful, please give it a like and subscribe to our channel for more practical tips on healthy and safe aging. Click the bell icon to be notified of new videos. Do any of these points resonate with you? What other advice have you received? Share your thoughts in the comments below. Thank you for watching. Stay safe and be well.